I call the Shadow Minister, Dr. Luke Evans.
Thank you, Madam Deputy Speaker, and can I thank the member for Wimbledon securing this debate. I set off and I was going to test the patience of the House by reading all the hospices that were named, but when we've got to 45 and time is so short, I won't try the patience. But I think it's a testament to see how many examples we've had in this House that members have brought that speak so fondly about the services that they have. Now, responding as His Majesty's opposition, I'd like to discuss three areas. Firstly, the conversation about death. Second, the palliative services in the ecosystem. And thirdly, specific technical questions. Because when it comes to the conversation, it's rare that in this House we debate a topic that impacts everyone, literally. And so it's an honour to play my part in highlighting something I've long argued isn't talked about nearly enough. That's death and dying. We all know the only certainty is death, unless that's variable. And the variable part is the quality. And that's what it's come down to for the focus of today's debate. After all, it was Woody Allen who said, "I'm not afraid of death, I just don't want to be there when it happens." Now, palliative care services dedicate their lives to making sure people who will die do so with dignity. And many people often think of hospitals or hospices in death and the staff that do the fantastic work, but we mustn't forget the pivotal role the likes of district nurses and GPs play ensuring there is palliative care in our nation. In my constituency, I'm blessed with hospice care from Loros for adults and Rainbows for children, both who are much loved by the public and, most importantly, supported by armies of volunteers, people who deserve this House's recognition and the public's recognition and respect for just what they do to contribute to our society. Now, dying can be a difficult subject to talk about, and I know from my clinical days, but that doesn't make it any less important. So I pay tribute to this House in the way in which it handled and discussed the assisting dying debate. And whatever position you took, it's fantastic to see a national debate now taking place up and down dinner tables of this country. So my first question to the government is, what is being done to ensure that people look to plan their deaths better? Now, when we talk about the wider ecosystem, we've got to consider the roles of hospices, hospitals, and primary care providers like district nurses, who are all key stakeholders. And by the very nature how they've ended up being involved in palliative care, they came from different journeys to do so. Now, it's beyond this debate, but it's so important because it informs the makeup and patchwork of palliation across this country. As we've heard, there's a balance between the charitable funding and the NHS funding. And even this House is divided on what that formula should look like, whether it should be solely state-funded or charitable. So my second question to the government is, would the government consider consulting on a long-term funding model that allows this debate to take place so that we have a better balance between the two? And building on this, looking at from the clinical part of the issue at play is what that provision should even look like. So my third question is, will the government commit to establishing agreed basic standard criteria for service level provisions and getting a national agreement for the provision of palliative care services and what they look like for whatever a person should choose? Now, it comes to the record of the last government. We were the government that legislated in the Health and Social Care Act in 2022 to ensure that there was commissioning taking place. As part of the NHS response to COVID, 350 million was given to support hospices in those difficult times. The NHS England also put in grant funding for a 24/7 palliative care single care point access support, and also increased the funding, as we've heard, from the Children's Hospice Grant from £15 million in 2020-2021 to £25 million, and I'm pleased to see the government continue that trajectory. To help manage staff, this was the government that brought forward the first ever NHS workforce plan, and I'd like to commend the government again for continuing to commit to that. However, with the debate about assisted dying and the concerns expressed by the Health Secretary about provision, my fourth question is, what assessment has the government made about the impact of assisted dying on provision? Because I believe the Secretary of State was commissioning work on this. And when will it release the results? So when it comes to assisted dying and the ability to provide the services, This isn't the right place to suggest whether they are right or wrong, but I hope that whatever happens with this bill, whether it passes or not, we do not let that distract us from the mission of continuing to improve palliative care and end-of-life services. The momentum is both here in this House and in the general public. Now, turning to the specific questions from the sector, it would be remiss of me not to raise the concerns about Labour's budget and the impact on the palliative care sector. The national insurance contribution increases on employers is a tax on charities. Fact. They are not covered by the NHS exemption. Hospices are charity. They are being taxed. Fact. GPs provide palliative care and support. They are not covered by the NHS exemption. They are being taxed. Fact. And Hospice UK have estimated that an additional £30 million will need to be found. This means that charities and non-profit organisations like Sue Ryder, Macmillan, Marie Curie are being hit with additional wage bills requiring more money just to provide the same level of care. Now, the government has said that it will give £100 million to hospices, but it's been made abundantly clear in this debate that is for capital expenditure only, unless the Minister would like to correct me. So when it comes to the spending review, what assessment has the government made of what this will look like when it comes to palliation? Because it's hard not to see that this looks like a Labour government that's giving on one hand while taking on another, taxing GPs, taxing hospices to give them back money in a way they don't want it. Yeah. Could I ask the Minister on this topic of staffing and contracts as well? Some staff are employed by the NHS, while others are directly employed by hospices themselves. Has the government made an assessment of what this has when it comes to recruitment, what the impact it is? For example, palliative care consultants have a postcode lottery of terms. Would the government consider looking at this? Which throws up another issue and oddity in the sector. Given those contractual arrangements, when it comes to indemnity, some NHS palliative care consultants have Crown indemnity, while others employed by hospices don't, costing them thousands of pounds. Would the government consider looking at this? Turning specifically to the allocation of funding, I'd like to raise the process. Together for Short Lives have called on the government to confirm whether the £26 million will be ring-fenced for Children's Hospital and distributed centrally to avoid delays. Now, previously, the decision was made to give it to ICBs to better help local decision-making, but this has, as a result, while well-meaning, mean there can be delays. So is the government aware of this issue? And if so, would the Minister commit to working to smooth this out? In conclusion, there's much more I could say on this topic, and I'm sure many others could do too. We know that the UK has an ageing population and that demand for palliative care will continue to rise over the next decades to come. But here in this House, we have the opportunity to make a difference for all who come after us. After all, at the heart of looking after dying comes compassion. True compassion means not only feeling another's pain, but being so moved to help relieve it. And this government has the power to do so. And I hope in turn they will.
I